On today's Acupuncture Masterclass quick tip, stop trying to memorize each individual point's actions and indications. Today, I'm going to show you some helpful tips on how you can categorize the actions of certain acupuncture points based on their anatomical location, reducing the need for all that memorizing. Let's take a look. Sometimes points located on specific areas on the body have generalized point actions. Here are the top 3 acupuncture point generalizations, which will not only help you remember your points faster, you'll also choose points with more relevance and have better patient outcomes, all leading to you becoming a better acupuncturist. Let's look at the first group. Have you noticed points around the elbow crease or cubital crease all clear heat from their respective organs? Lung heat in your diagnosis? Lung 5, located on the lateral side of the biceps tendon on the cubital crease. Heart heat in your diagnosis? Heart 3, located just on the medial end of the cubital crease with the elbow fully flexed. Large intestine 11, located on the lateral end of the cubital crease when the elbow is fully flexed. Actually clears heat in general for all organs. It's also great for heat manifesting as skin problems, presenting as red, dry skin rashes, such as eczema. We also have pericardium 3, small intestine 8, and triple warmer or Sanjiao 10. All have the same heat clearing action, although clinically use less than the previous points mentioned. So if you need to clear heat from an organ which resides on one of the hand meridians, a great option is a point from the elbow crease. Okay, on to the next group. Just like the elbow, the points around the knee can be generalized for the function of draining dampness. Spleen 9, stomach 36, gallbladder 34, liver 8, and kidney 10 all have very strong functions of draining dampness. Spleen 9 is one of the most popular points for this action. Remember, the spleen transforms and transports dampness, so spleen 9 is very common clinically. Kidney 10 drains dampness when the dampness presents mostly as urinary symptoms. Gallbladder 34 drains dampness which typically shows as dampness from the genitals, such as with discharge or infections. Liver 8 is very popular for tonifying liver blood, but it also drains dampness from the genital area. The only outlier here is UB40, urinary bladder 40. It doesn't have as many dampness-related actions. However, it is very common clinically for things like cooling the blood and is a must-do for any type of back pain, being the command point of the back. If you've got dampness to deal with, consider the points around the knee, especially if that dampness is directly related to an organ whose channel resides in this area. Okay, on to the final group. There's another special group of points which clear heat in TCM, the last 2 points at the fingers and the toes, often referred to as the Jingwell and the Ying spring points. All of these points clear heat from their respective organ as well. Think of some of these points: liver 1, liver 2, spleen 1 and 2, kidney 2, stomach 44, stomach 45, gallbladder 43, 44, all extremely popular points to clear heat from their organs, particularly with excess problems like excess heat. Except for the kidney, there's no excess kidney concerns with heat. Excess liver fire, definitely choosing liver 2. Maybe deficiency heat in the kidney, kidney 2 is when you would use that point. Fire in the stomach, stomach 44 will clear that fire. Same with the points at the fingers, heart 8 and heart 9, pericardium 8 and 9, lung 10 and 11, large intestine 1 and 2, Sanjiao 1 and 2, small intestine 1 and 2, all clear heat. Some more commonly used than others, but they all have this heat clearing ability. And it's so easy to remember. So let's talk about the points at the corner of the nail beds. They all clear heat, but they are so sensitive to needle. A 3-edged needle is the traditional method of needling these points. However, for better sanitation and proper clean needle technique, I suggest you use a lancet, the same one you would use to test blood sugar. You can even adjust the depth that the lancet goes, creating less discomfort and more consistency with your depth. So in summary, points at the elbow crease, clear heat. Knee points, resolve dampness. And the last 2 points at the fingers and the toes, also clear heat. Remember these tips when you're in clinic or doing a case assignment and you are certain to impress your clinic coordinator. Now, if you like the ideas I explained in this video, you might be interested in my new online course, Acupuncture Point Selection Mastery, where I teach you my 5-step process for choosing the most clinically relevant acupuncture points for any TCM diagnosis, faster and easier than you ever thought possible. Just click on the link below to see the free preview. Thanks again for joining me today. Definitely comment below and let me know what you're interested in seeing in future videos. Now get out there and be a better acupuncturist.